Members, Senate File 2313 is a bill that creates unified personal health premium accounts. This is essentially a change in law that allows a trust account to be created and allow individuals to have ownership of the proceeds of that account, and allows that account to receive contributions from a variety of sources, and the proceeds of that account to be used only for the payment of insurance premiums, either individual or group plans, self-insured, flexible benefit plans, other types of insurance plans included in Section 60A.096. So what this is designed to do, members, is to create an opportunity for more people to own insurance who currently may not have opportunity to own insurance. It also creates an opportunity for that insurance to be portable, so that it is not entirely dependent upon where a person may be employed. And it also, we believe, will affect the affordability of insurance as insurance plans and providers begin to market to individuals and allow them to purchase products that more meet their personal needs as well as their financial needs.
Lack of transparency, lack of accountability, no explicit fiduciary responsibilities and duties stated in this bill. You know, trustees clearly have fiduciary duties under the law, and administrators under this bill do not, unless they happen to fall under an organization that has them through some other mechanism. But under this bill, there is no explicit fiduciary responsibilities and duties. That is very, very irresponsible to set up trusts for the people of Minnesota to administer important health functions for them without being explicit about the fiduciary responsibilities and duties due them. There's clear financial conflicts of interest they're here for insurance brokers and administrators of these accounts. They will not only guide individuals to coverage options, but also submit direct payment to the very entities who may pay their commissions or salaries. To act as a true fiduciary under the law, if that duty does not exist for brokers under this bill, it's critical that a broker be able to fulfill the duty of loyalty with no self-dealing or other actions taken for a personal or financial advantage. These issues are not addressed in this bill and left open to the marketplace to take advantage of people in Minnesota, and we owe them a voice at the table to help us understand these effects. You know, this is so wrong and so offensive, the process that this has been through. I'm just going to stop. We got a letter from the governor that asked us very clearly not to follow this path and to have an open, honest, transparent dialogue. And this is really wrong, what's happening here on the Senate floor today, and I take it very, very seriously.
Senator Hoffman.
Thank you, Mr. President. Unlike my colleague, Senator Lourey, I think this is a very good day for the state of Minnesota. I think that it's time that we have this discussion in public about health insurance, the cost of health insurance, and government interference in a health care market where we don't need the government. The more government gets involved, the higher health care costs have gone. I've been a nurse for a good part of my life, and I've seen more and more regulation come down, and I've seen health care costs skyrocket. And so the idea that we are talking on the Senate floor here that consumers aren't able to make their own decisions, that you've got to have the big hand of government coming down to tell a consumer what kind of health insurance they should buy, what kind of coverage they want, who they should see, what they should get treated for, I think that's insulting to consumers. And for every one of these agencies that have, or these advocacy groups that are here that represent people, I represent individuals who do not have a large lobbying group to come here and try and lobby for a single-payer health care system. The statistics out in the market, the polls out in the United States show that the majority of the people in this country do not want more government in their health care. They want their health insurance should be insurance again, and health care should be health care.